Here I am.
I've lived with hearing loss for 30 years.
5 years.
13 years.
Over 80 years.
I used hearing aids for approximately 10 years, but in the end the hearing aids were no longer working.
I had the top of the range hearing aids and that was not enough.
Hearing loss separates you from people, and that for me is very, very difficult.
I felt excluded and depressed.
Hopeless, dependent.
We got pretty low when I thought I was never going to be able to get any more work. All my years of qualifications and experience were for nothing.
I could not answer the phone, I could not talk to my partner, I couldn't talk to my family, I couldn't talk to my grandkids. That was my wake-up call.
That was my wake-up call.
That was my wake-up call. It was my audiologist who first mentioned a cochlear implant to me.
When I was referred for a cochlear implant, I was quite excited and just a little bit nervous, but it was the best thing I ever did.
Life after a cochlear implant it's incredible.
It makes a difference in every avenue of life.
I can pick up the phone and talk to my grandchildren. I can hear my daughter. I can talk to my partner. I can hear the TV. I can even hear raindrops on the leaves outside.
I can talk to you, which I would not have been able to do.
I was able to take on the sorts of work that I really am passionate about.
You can't measure gratitude when it changes your life so much.
It really is like life-changing. Absolutely. Can't speak highly enough of it.
Good morning, ladies and gentlemen, and welcome to the 2019 Annual General Meeting of Cochlear. I'm Rick Holliday-Smith, Chairman, and it's my pleasure to welcome you to today's meeting. I acknowledge this AGM is being held on the traditional lands of the Gadigal people of the Eora Nation, and I pay my respects to their elders past and present. I welcome those observing the meeting through our internet broadcast, and a recording of today's proceeding will be available on our website. The notice of meeting has been sent to all shareholders, and I'll take it as read, and I've signed the minutes of the last meeting, and a copy is available at the registration desk. There's a quorum present, and I declare the meeting open. I'll now provide an outline of order of proceedings. After I've introduced the board, I'll give my address, followed by that of our CEO and then our Chief Technology Officer, who will both make presentations. After that, we'll discuss the formal items of business. I think a good time for your questions and comments and broader discussion should be when we consider the financial statements, and I'll ensure all reasonable questions are covered at that time. Once the meeting is concluded, there'll be refreshments available in the reception area upstairs, and senior management and the board will be available at that time to discuss matters of interest with you. I'd now like to introduce your directors. You'll have noticed that detailed biographies are included in the annual report, and where directors are offering themselves for re-election, these details are in the notice of meeting. On my left, we have the Group General Counsel and Company Secretary, Ray Jarman, and next to Ray is Dick Howard, our Chief Executive. On his left is Yasmin Allen, who is standing for re-election today, and beside her is Glenn Borum. Next to Glenn is Alison Deans, and beside Alison is Andy Denver. Then our newly appointed Director, Abbas Hussain, who is standing for re-election today. We then have Donald O'Dwyer, who is standing for re-election today as well. And finally, we have Professor Bruce Robinson. In line with the Corporations Act, our auditors KPMG are present and are represented by the engagement partner, Julian McPherson, and later in the meeting, they will be available to answer questions on matters such as the conduct of the audit and the audit report, if so required. The availability of the auditors to answer questions at an AGM is uniquely Australian, and I believe it's an important part of auditor accountability. I'd now like to move to my address. FY19 was a busy year for Cochlear, with a focus on building awareness and market access to cochlear implants, expanding our marketing activities and customer servicing capability, while maintaining our commitment to product innovation through our investment in research and development. In August, we reported a net profit of $276 million, an increase of 13% from last year. Reported net profit includes $10.8 million of net gain from the revaluation of innovation fund investments. Net profit excluding the revaluation was $266 million, an increase of 7%. Earnings growth, combined with strong cash flow generation, supported a second half dividend of $1.75, with the full year dividends increasing by 10% to $3.30 fully franked. The current dividend policy has been maintained with the objective to pay out 70% of net profit as dividends, and this policy is reviewed annually. I'll now discuss some of the important initiatives that we will hope will contribute to the uptake of cochlear implants across the coming decade. Firstly, the importance of building a consistent treatment pathway for adults and seniors. Over the past 30 years, cochlear implants have been established as the standard of care for children born with severe to profound hearing loss, with high adoption rates across most developed countries. The challenge today in developed markets is the lack of a consistent treatment pathway for diagnosing and treating adults. For many adult candidates, the pathway to cochlear implants is often haphazard, with most unaware of the existence of these solutions. Cochlear is working to build grassroots awareness with adult candidates, including through its successful direct-to-consumer marketing activities. And in the US, we're focused on building referrals from the hearing aid channel through the establishment of the Cochlear Provider Network, which links surgeons with hearing aid clinics, while at the same time building professional awareness through improved education. We're encouraging initiatives within the professional community, including leading cochlear implant surgeons and audiologists, to develop a consensus on the appropriate treatment pathway for adults. In March, an independent steering committee and panel of 30 audiologists and ENT surgeons across 13 countries, chaired by Professor Craig Buckman from Washington University, reached a consensus that could lay the foundations for the creation of international clinical practice guidelines for cochlear implantation, including patient identification, referral, implementation, and rehabilitation. This independent process received funding support from a cross-industry group, including Cochlear, none of whom had a voting role in the consensus. One of the growth drivers for cochlear implants is the expansion of indications for funded implants. There are many countries that have either restrictive clinical indications or capped funding which limits access. We've been building our global market access capability to advocate for the expansion of both indications and for the funding for cochlear implants. In March, the National Institute of Health and Care Excellence, NICE, in England, expanded the criteria health professionals use when determining who is suitable for a cochlear implant within the National Health Service to include candidates with a severe hearing loss. And in August, the Belgian Medicines Verification Organisation also announced the expansion of reimbursement criteria for cochlear implants to also include candidates with a severe hearing loss. These changes more than double the number of people who can now access a cochlear implant in both countries. The news is a major milestone that is expected to support growth in the UK and Belgium over the coming years. And it follows recent changes in Japan and Taiwan or Greater China, where the expansion of clinical indications and/or reimbursements for cochlear implants has driven growing demand for implants following the changes. From a long-term product development perspective, we achieved a major milestone this year by entering the next phase in the development of a totally implantable cochlear implant. with the start of a further clinical feasibility study. This study will evaluate the performance and safety of our totally implantable cochlear implant technology, which can be used with and without an external processor, providing people with 24-hour hearing. The clinical study is being conducted in Australia, led by Associate Professor Robert Briggs in Victoria and Professor Robert Cohen. It's expected to build on the initial clinical research conducted in 2005 with the first generation device and will inform further technology development. The development of totally implantable cochlear implant technology is complex, and we do not expect a commercially available product for many years. Developing and strengthening our strategic alliances is important for Cochlear. And in November last year, Cochlear and GN Hearing agreed to further strengthen their technology and commercial alliance to develop best-in-class integrated hearing solutions. The deepening of this relationship includes joint R&D, shared technology, and a strengthened global smart hearing alliance collaboration between Cochlear and GN Hearing, the hearing aid division of the GN Group. Working closely with GN Hearing allows us to bring the latest in connectivity and wireless technology to our implant recipients more quickly. We're also able to give recipients with a cochlear implant in one ear and a GN hearing aid in the other ear unparalleled performance and a seamless experience with both devices. As two leaders in hearing health, this collaboration demonstrates our commitment to design and to bring to market the best hearing solutions available. In November, Cochlear made a new addition to the Innovation Fund, investing €13 million into a company called Nyxoah. Nyxoah is a medical device company focused on the development and commercialisation of a best-in-class hypoglossal nerve stimulation therapy for the treatment of obstructive sleep apnea. The Nyxoah investment is part of Cochlear's Innovation Fund, an internal fund established to invest in novel technologies and implantable devices that over the long term could leverage or enhance Cochlear's core technology. We've also made sound progress in development of our new manufacturing facility in China, which is running to schedule. As you can see from the slide, the construction phase is well underway, and we expect to complete this stage in mid-2020. The next stage will be the regulatory approval process in China, a process expected to take approximately 2 years for this type of complex manufacturing facility. Now to a short update on the long-running patent dispute that has been well disclosed and is set out clearly in our financial statements. As you are aware, we've made every effort to disclose the financial implications of the worst-case negative outcome and the nature of the issues confronting us. This complex matter has been running for many years and has seen both ups and downs. The last decision favoured the other side, being the Alfred E. Mann Foundation for Scientific Research and our major competitor, Advanced Bionics, who are now part of the Sonova Group. We have lodged an insurance bond for US $335 million as part of our counter-appeal process, and we have many disagreements with the latest rulings in this gyrating process. The board has always and continues to obtain independent legal advice on Cochlear's actions and prospects. And the board believes it is probable that Cochlear's appeal will result in the lawsuit being remanded to the District Court for a retrial on damages. Most importantly, Cochlear's current product portfolio is not affected by this litigation, as the patent at issue has expired, and we maintain a very strong balance sheet with conservative gearing levels. In the event the appeal is unsuccessful, the board is confident that Cochlear can access necessary debt facilities to fund the judgment and to cover any award of interest and/or costs. Turning now to a more positive topic, that being our employees, We strongly believe that training, development, engagement with them is vital for us to thrive into the future. We're a fast-growing organisation, and there have been over 900 people hired or promoted in the last year. That's up 26% from the previous year. Training and development have both been strengthened with the implementation of globally consistent leadership programs, with Cochlear recognised by the Association for Talent Development as a best learning organisation. We've continued to progress succession planning and implement targeted development for our senior executives and managers, with an increase in women identified as successors for many roles. We're pleased our employees continue to find Cochlear a rewarding place to work, and overall employee engagement scores remain high at 79%, about the same as last year. I'd now like to talk about the proposed changes to the long-term incentive plan. This year we're proposing to extend the length of the plan from 3 years to 4 years, as well as recalibrate the EPS targets. The EPS targets are shifting from 10% to 20% compound annual growth over 3 years to 7.5% to 12.5% over 4 years. This change is material and requires some context. The current EPS targets have been in place for at least 15 years and are now considered inconsistent with our expectations and our strategic objectives for growth. This shift will provide better alignment to our strategy, factoring in the market conditions and related growth rates that we believe are realistic. 15 years ago, our industry was at an early stage of development, with 15 to 20% unit growth more common as we penetrated the newborn segment across our developed markets. Today, cochlear implantation for newborns is the standard of care across most developed markets, with most children receiving cochlear implants at around 12 months of age, and this is an enormous achievement. While there are still some developed markets with opportunities for growth in the child segment, including the US, Japan and France, future growth will be focused on adults in developed markets and children in emerging markets. Each poses its challenges, but provides a long-term opportunity. The board believes the components of our diversified revenue base, including the growth in the services business and our focus on delivering steady long-term profit growth, means the new EPS targets better align this component of long-term incentives to company strategies. We want to deliver consistent growth in revenue over time, with earnings expected to grow at a similar rate to revenue as we invest strongly to grow the business into the future, with an intention to hold the net profit margin. We believe the revised range reflects stretch performance and will ensure executives are engaged and incentivised appropriately to deliver results. Give me 1 minute, I'm talking too much. I'll now turn to board matters. As a board, we recognise the importance of a regular process of renewal. Over recent years, we've implemented a board renewal process, bringing onto the board a number of new directors with diverse backgrounds and relevant experience. We've sought to maintain a balance of continuity and to introduce new skill sets. We've been pleased with all the recent appointments, with the new directors adding great perspective and value to our board discussions. We've added one new director this year, with Abbas Hussain appointed to the board effective last December. Abbas worked in the pharmaceutical industry for over 30 years and has significant global experience in building relationships with professionals within the healthcare industry. He also brings expertise to business development and growth opportunities across a diverse range of markets. He is well equipped to provide valuable strategic insight and has demonstrated strong values in customer focus, which is intrinsic to Cochlear's strategic objectives. The appointment of Abbas follows the retirement of long-serving director Professor Edward Byrne at the last AGM. We believe Cochlear is well served by experienced directors with knowledge of our business and our culture. That requires some period of knowledge development for new board members, and at the end of service, an appropriate knowledge transfer. We're also conscious of the need to diversify the board, and there are active plans to do that over the next few years and before I leave. We're conscious of the importance of every director appointment, and there are excellent candidates that we strongly believe will become available to us in the next 2 years that are well worth waiting for. As you know, I've been a director of Cochlear for 14 years. After discussion with the board, I'll present myself for re-election at this AGM to serve my last term as chairman. I'll be working closely with the board on the renewal process for my role, and it is likely I'll retire from the board during this new 3-year term. I think the board works well together, and I thank my board colleagues for their hard work and commitment. The board fully endorses those directors who will present themselves to you later in this meeting, and we hope they receive your support. Now moving on to new shareholder reports. We're committed to providing transparency to shareholders across a broad range of areas, including our policies and strategies, which is done through our growing reporting suite. This year we published our first strategy overview and environmental, social and governance reports, and improved the usability of our corporate governance statement. The strategy overview provides an insight into Cochlear's strategy to retain market leadership, grow the hearing implant market, and deliver constant revenue and earnings growth. It provides a greater detail around our long-term priorities, as well as laying out the over 20 years of historical financial performance of your company. In April, we published our inaugural ESG report with a strong history in helping people and the communities we live in. We want to lead with purpose and address serious challenges such as global hearing health, climate change, culture, and gender equality. The ESG disclosure will provide a platform to communicate our progress and outline our goals in leading the way to a sustainable future. Given this is our first report, I thought it would be valuable to call out some of the elements of the report. We're expanding our environmental management system to capture our environmental impact and improving our energy mix by transitioning to renewable sources. While we're making progress in reducing our carbon footprint, we're seeking new ways to improve our energy efficiency and other opportunities in our global operations and our partners across the supply chain. As part of this process, we've sourced renewable energy in Australia, Belgium, Sweden, Switzerland and UK, including the installation of rooftop solar at our head office in Macquarie Park, Sydney. When it comes to people, Cochlear is committed to providing an inclusive workplace that is diverse and representative of our stakeholders, including our customers, shareholders, employees and communities. We employ over 4,000 people from over 75 nationalities, with products sold into over 100 countries. Since the introduction of Cochlear's diversity and inclusion framework last year, we've invested in several initiatives to grow and attract talent while ensuring a respectful and inclusive culture. Some examples of this are our Chief Executive has joined the Male Champions of Change, an Australian organisation that engages senior men in championing gender equality. We implemented Flex at Cochlear to better support our people in balancing their work and personal commitments. We triple paid parental leave for both primary and secondary carers in Australia, and we introduced purchase leave and domestic violence support, and we also increased female representation during the interview and selection process, with global female hires increased from 56 to 58% last year. Regarding governance, we're committed to high standards of corporate governance. This is seen as important for the creation, protection and enhancement of shareholder value. We see ourselves as a business particularly committed to serve our recipients, and that means we take a very long-term view. The children implanted today will likely live for 100 years. We need to be there to support and serve them through life's journey. We think about the next 100 years. We must consider all stakeholders in our decision processes, and it goes without saying we expect our directors, senior executives and employees to act ethically, lawfully and responsibly at all times. These reports are all available on the website, and I encourage you to read them. I now want to talk to financial expectations for 2020. In August, Cochlear announced that we expect to deliver reported net profit for FY20 of $290 to $300 million, a 9 to 13% increase on underlying net profit from last year, and this continues to be the case. Growth is expected to broadly continue across the business in FY20, underpinned by the continuing investments made in product development and market growth initiatives over the previous years. We will continue to invest in activities aimed at building awareness and market access with the objective to deliver constant revenue and earnings growth over the long term. Through disciplined investment, we are targeting to maintain the net profit margin, reinvesting any efficiency gains, currency or tax benefits into market growth activities. Our balance sheet and free cash flow generation remain strong, and we continue to target a dividend payout ratio of 70% of net profit. Finally, I'd like to acknowledge the contribution of each of our 4,000 Cochlear employees. The knowledge, expertise and passion of these employees are key to our future, and the focus on delivering excellence for our customers is an important part of our success and our market leadership position. Our employees understand the importance of Cochlear being successful over the long term, so we can continue to support our recipients. There are few companies that start a lifetime journey with each new customer every day. On behalf of the board, I congratulate and thank all Cochlear employees for their outstanding efforts and contributions this last year. And I'd now like to invite the company's CEO, Dig Howitt, to talk to you.
Thank you, Rick. And ladies and gentlemen, it's a pleasure to be able to talk to you this morning and to give you an overview, brief overview of our strategy and some of the progress we have made executing that strategy. And I want to start the presentation with Cochlear's mission. So the mission is very, very important for all of our employees right around the world at Cochlear. And I want to tell just a short story that I think demonstrates the importance of our mission and how our mission guides what we do. So recently I was at a function and someone sitting next to me, once they found out I worked for Cochlear, leant over to me and said, I just want to tell you that the daughter of a family friend of ours in the UK just recently got a cochlear implant, and this young lady's 19 and heading off to university, and he said, really transformed her life. She's now able to go to university, be able to communicate confidently with her peers, having struggled for most of her life with high-powered hearing aids. So this really speaks to the second part of our mission of being able to connect with others and to live a full life. But without knowing all of the details behind this story, I think there's actually more to it. Rick just mentioned that in the UK in March this year, there was an expansion of indications for cochlear implants from 90 decibels, which is profound hearing loss, to 80 decibels, which is the mid-range of severe. Now, having heard a little bit about this young lady and her background, I'm sure that she fell between 80 and 90 decibels with her hearing loss. So until March this year, she wasn't eligible to get a cochlear implant. But because of the work that Cochlear did with the cochlear implant professionals in the UK over several years, there's been this expansion of indications which has changed how hearing loss is treated in the UK, which is the middle part of our mission there. Now, why was there evidence that showed that expanding indications of cochlear implant was the right thing to do because it could help more people. And that's come from 20 or 30 years of innovation that have improved the outcomes of cochlear implants so that people with better hearing are now eligible for cochlear implants because of the performance and the outcomes they get, which speaks to the final part of our mission on innovation. So I hope just that little story gives you an indication of how our mission guides the work that we do. And that's just one story. Around the world, each week, we supply around about 1,000 implants to people. And in doing that, we hope that we're creating more stories like that to give more people the opportunity to reach their potential and to be able to connect with others and to live a full life. So with our mission as context, we have 3 strategic priorities that Rick mentioned, and I want to talk to each of those. First, we want to retain market leadership, and that comes from having world-class technology and making sure that we have world-class experience for people who have our technology and use that to hear every day. And this is important. Retaining market leadership is important, and it's important because we need to work with our customers over their lifetime. And typically, if you look back, if you look at business history, the companies that last for a lifetime are the leading companies in the industry. There are very few number 2 or number 3 companies that last over the very long term. So that leadership is important for outcomes for our customers over their lifetime. We want to grow the hearing implant market, and we want to do that through building awareness, through building access, and we need clinical evidence to do that. And we want to do that because there are millions of people who fall within the indications for cochlear implant who do not get access through awareness or through lack of awareness or through lack of access in specific countries. So it's a significant opportunity there, and I want to talk to that. And finally, as Rick said, we want to deliver consistent revenue and earnings growth over the long run. Now, that's obviously very important for all of us as shareholders, but it's critically important also for our customers. Going back to that first point, that it's in our customers' interest for Cochlear to be successful, because only successful companies survive, and survive for the long term to be able to support our customers throughout their lifetime. So now I want to step through each of these just very briefly. So I'll talk briefly on technology leadership, but Jan Janssen, our Chief Technology Officer, will speak after me to give you more detail. So it's very, very important that we continue to invest in R&D. We're aiming to invest around 12% of our revenue each year. Last year that was 184 million Australian dollars. And since Cochlear listed on the ASX, we have now spent nearly $2 billion building our technology portfolio. And it's that year-on-year investment that builds outcomes, that enables expansion of indication, enables us to give more people hearing over time because of the quality of the outcomes and the technology that we have built. So Jan will talk about some of the important priorities in R&D. I did want to show our product portfolio, because I think very clearly we have the leading portfolio on the market for both cochlear implants and for acoustic implants. So the products shown here are some of our latest generation products. And that investment that we make continues to build on that portfolio and to develop that portfolio over the years so that we stay at the leading edge and certainly ahead of our competitors in terms of the overall system. So now let me move to market growth. When we think about market growth, we think about it in terms of 3 different segments. And so while the products are the same across those segments, the surgery is the same, the access to the market and our strategies are quite different for each of those segments. That's why we think about these segments differently. So adults and seniors in the developed market is our most important growth opportunity probably over the next 10 years. And this is typically people who have progressive hearing loss. So their hearing declines over their lifetime. At some point they become eligible for hearing aids, or hearing aids will provide a benefit. For many of those people, their hearing will continue to decline to a point where hearing aids are no longer effective. I will talk a bit more in a minute just about some of our strategies to get access to that market. Children in the developed markets, this is really the area where most of Cochlear's growth came from probably up until about 2009 and 2010. And this was built on the back of newborn hearing screening across the developed world, very strong referral paths, very good technology, good therapy, leading to children who got early access, attending normal schooling, growing up and being able to reach their potential and be fully productive members of society. Many of the earlier children who got cochlear implants in the early days have now progressed through university and on into successful careers. And then finally, as children in emerging markets. So this is, again, a significant opportunity. It's a very long-run opportunity. Some markets are developing faster than others, but there we think the penetration in that market is only around 10%. So a significant opportunity to help more children right around the world. So let me talk then briefly on adults and developed. And really, our goal here, as Rick said, is to build a clear and consistent referral path from hearing aids to cochlear implants for those people who fall within the indications of cochlear implants. And in no country in the world at the moment is there a clear and consistent referral path to cochlear implants. And we see as industry leaders that it is our role to take the lead in developing this path. We can't do it on our own, but we can certainly take the lead in trying to build this path. And to do that, we need to work with 4 stakeholders that are shown on the slide. So the first of those is candidates. It's people who may be eligible for a cochlear implant. So we're working around the developed world to expand awareness. That video that we opened the annual general meeting with is a long version of a television advertisement that we are now running in Australia. So that's a trial. We're working out ways that we can expand awareness. So we're doing this trial in Australia with a TV advertisement just to see what sort of response rate do we get from that. We're doing quite a lot on the internet around the world to promote awareness. And now a significant proportion of our sales, still a minority, but a significant proportion of our sales around the developed world come as a result of our direct-to-consumer, that's what DTC stands for, direct-to-consumer promotional activities. And as we do that, we're learning the best ways to educate and to build awareness that are cost-effective and are targeted to make sure that we're giving people the opportunity to get access to cochlear implants. The second one is the non-cochlear implant professional, and this might be a hearing aid retailer, a hearing aid audiologist. It might be an ENT doctor who doesn't do cochlear implants. But what we see in practice, in the numbers, what we see in our market research is that there is very low awareness of the indications of cochlear implants in both hearing aid audiologists and even within ENT doctors who are not familiar with, not doing cochlear implant surgeries and therefore not familiar with it. And that's one of the barriers, clearly, to referral, that if people don't know about the technology, they won't refer. Now, we need some data to do that, and I'll talk about some data that we've got in a minute. And Rick mentioned CPN, the Cochlear Provider Network in the US, and how we're linking cochlear implant surgeons with audiologists to educate on the indications of our cochlear implants and the outcomes from cochlear implants. The cochlear implant professional, we need professionals to be able to counsel effectively and deliver consistent care. Now, on the whole, that happens, but as we work towards making cochlear implants the standard of care for adults and seniors, we can help expand capacity in clinics and make sure that people get the best outcomes that they can. And finally, and very, very importantly, is we need to make sure that implants are reimbursed, that someone will pay for the implants. And for payers, we must have data. It's great that people get good outcomes, but payers want to see not only good outcomes, but they want to see economic data that shows the benefits of treating hearing loss and how effective treating hearing loss is. So we're working in all of these areas to try to build this clear and consistent referral path from hearing aids to cochlear implants. Now, I just want to show some of the data that we have generated in the last year that shows how effective cochlear implants are. So we ran a study with our latest, what was then our latest technology, our 532 cochlear implant, Nucleus 7 sound processor, and we took 100 people in the US across many centres, and these people came in indications, so severe to profound hearing loss, and we measured with properly tuned high-powered hearing aids before they got a cochlear implant, their quality of life, their hearing performance, how many words did they get right, and their self-rated satisfaction with their hearing. Then at 3, 6 and 12 months after getting one cochlear implant and one GN ReSound hearing aid, and Rick talked to that partnership, that means you can stream to both ears at once, we again measured those three things: hearing performance, quality of life, and self-rated satisfaction with their hearing. And the results that we saw there were really, perhaps not surprising to us, but pretty astounding. So this just shows the self-rated satisfaction with hearing performance. So what it says is that 9% of people going into that study said that they were satisfied or very satisfied with their hearing with 2 high-powered hearing aids. 12 months later, with one cochlear implant and one high-powered hearing aid, 95% of them said that they were very satisfied. And we tested their satisfaction across a range of really important listening environments. So if we go back to our mission, wanting people to connect and live a full life, you don't want to be able to hear in a sound booth. You want to be able to hear in front of the TV. You want to be able to hear in a small group conversation. You want to be able to hear when there's background noise. You want to be able to hear and listen to music. And you want to be able to use the telephone to be able to communicate with people. And that shows the difference in satisfaction of people across each of those. And then when we did look at laboratory testing scores, we saw more than doubling of word understanding and significant improvements in quality of life equally over that time. So I think what this all says is that for many people within the indications of cochlear implant, a cochlear implant as a therapy is the most effective treatment available for hearing loss, far more effective than high-powered hearing aids for people within indications. And that's why there should be a clear and consistent referral path. But it's that sort of data that we can help use to educate referrers as to why they should refer. And why should they refer? Because there is a better alternative than a high-powered hearing aid for many people. So now to move to children in the developed markets. This is where hearing cochlear implants are the standard of care. In most developed countries, this system works very well. In Australia, we have the world's best system for early diagnosis, referral and treatment of children born with severe to profound hearing loss. We're then able to export that process and the data from that process to other countries around the world to expand indications and expand access. And that's what we've done over the years, so that now there are just a few countries, the US, France and Japan being 3 of them, where there is still an opportunity for a greater penetration. We do want to increase the number of the bilateral implants because it's very well proven that children with 2 cochlear implants do significantly better than children with 1 cochlear implant. And most of that, a significant part of that gain is because there is less processing power of their brain used on hearing when they have both ears working than just one, therefore more of their brain able to learn and get benefits from their education. And finally, which is still a gap in many countries, including Australia, is children that lose their hearing after birth are often not diagnosed early. So I know when I grew up, there used to be hearing testing at school. That now doesn't happen in virtually any country in the world, and that does mean that children miss out who are born with hearing but then lose it over time. So there's still a gap there with children that we can work on. And then the third segment is children in emerging markets, where the reasons for treating are exactly the same as for children in the developed world, but there is less infrastructure, less training, less awareness, and we are investing in emerging markets as their wealth increases to make sure that we build the infrastructure, that we provide training for surgeons, audiologists and therapists, that funding from governments comes through, and making sure that we've got a product offering that deals with people from different socio-economic tiers. So we work very hard in emerging markets, and we have seen good growth in those markets over time, albeit that they are more variable in the rate of growth and year-on-year demand, but there's definitely underlying growth. So that's a quick view of each of the 3 segments that we think about for growth. Now to move to the final part of the 3 priorities, which is making sure that we deliver consistent earnings and revenue growth over the long run. And the best way for us to do that is make sure that we invest back in the business. That's why we've said we want to hold the net profit margin constant, so our net profit grows with revenue over the long term, because we can invest in driving awareness, we can invest in building the clinical evidence, we can invest in R&D to make sure that we have the world-leading product portfolio, and that's what we are doing. We still want to work very hard and in a very disciplined way to be more efficient within the company, and as we generate savings from that efficiency, we will reinvest that into technology or into future growth. And as Rick said, we want to have, and we do have, a strong balance sheet, and we aim to continue to pay out net profit, 70% of our net profit as dividends. So then to finish up, I've looked at the three segments that we think about for growth. We have three lines of revenue, and we show here our revenue growth over the last 6 years, split by our cochlear implant business, which is about 58% of our revenue, services, which is sales to people who have an implant, so this is upgrade processes and spares and batteries. This is the lifetime support that we provide to people, contributes about 30% of our revenue, and then our acoustic implant portfolio provides about 12% of our revenue. We obviously are aiming to grow all three of those, again, over the long run, to deliver consistent earnings and revenue growth. So with that, I'd now like to hand over to Jan Janssen, who is our Chief Technology Officer. Thank you.
Thank you, Dick, and I welcome the opportunity to share with you some thoughts about Cochlear's technology strategy. So as we've heard from Dick and from Rick, cochlear implants are tremendously effective intervention for people that live with severe and profound hearing loss. But we believe that technology can continue to play a role to enhance the outcomes and living with a cochlear implant. And that's why continue to drive improved hearing outcomes is one of the key pillars of Cochlear's innovation strategy. But at the same time, it's important that people that live with severe to profound hearing loss and receive one of our devices can live a life that's as normal as possible. So we also want to make living with a cochlear implant or with an acoustic implant as simple and as seamless as possible. And that's the second area of focus in research and development at Cochlear. Thirdly, today, after receiving a cochlear implant, there's still a fairly complex and involved aftercare process that involves many visits to a clinic, for example, in the first year after surgery. And we believe that technology can play an important role in simplifying and streamlining the aftercare process. And last but not least, we also want to make sure that Cochlear has an appropriate portfolio of implantable hearing solutions to treat a wide range of hearing indications. And in the following slides, I would like to share with you some examples in each of these innovation focus areas. In terms of lifestyle, one of the examples of living with a cochlear implant and making life normal is making sure that people have access to also modern imaging technology. And Cochlear has taken access to MRI technology, which is a medical imaging technology, already very serious. Since the launch in 1997 with the first cochlear implant that was able to undergo a magnetic resonance imaging scan. And today we have already over 300,000 people that have access to MRI technology. But we can always enhance and improve the way that we provide access to these technologies. And we're very pleased that over the last few months, Cochlear has released the Nucleus Profile Plus series of implant. With this implant, which is designed for simpler MRI, recipients have access to both 1.5 and 3 Tesla MRI without the need to remove the magnet that helps to contain the external coil in place. There's also no need to use a splint or a bandage as part of the MRI procedure, thereby greatly simplifying access to MRI technology for those that have been implanted or will be implanted with the Nucleus Profile Plus series. We've built the Nucleus Profile Plus on the proven reliability of Nucleus Profile, which today is the absolute leader in the market in terms of implant reliability. And thirdly, we want to make sure that the implant cosmetics are not impacted by this enhanced level of MRI compatibility, and the Nucleus Profile Plus does remain the thinnest implant on the cochlear implant market, just measuring 3.9 millimeters of thickness. The other area that's, of course, critical for Cochlear's long-term success and market leadership is hearing outcomes. Now, hearing outcomes expose itself in many different forms. It is about word understanding that people can achieve in a quiet environment, but of course it's also very important in how how people hear in the real world. Particular difficult situations for people with hearing loss, or listening in noisy situations, or listening to music, or sound localization, listening effort, and so forth. And so it's Cochlear's objective over the coming generations to continue to close the gap that still exists today between hearing as a normal hearing person and hearing with a cochlear implant. One of the critical components in delivering cochlear implant technology is the implanted electrode array. As many of you know, a cochlear implant system consists of an external part which houses the microphone and does the processing of the sound. It then sends that sound to the implant decodes the sound, and ultimately needs to deliver the sound to the hearing nerve. And the part of the system that does this job, is the electrode array. And in other words, as I heard recently a physician make the comparison, it's where the rubber hits the road, it's like the wheels, the tires of a car. It's where the device meets the real world, is the electrode array. And so Cochlear has worked for many years to optimize hearing outcomes through improvements in through the electrode array. And we released about 3 years ago a new device called the Slim Modular Array that is delivered as part of the CI532, or now as a part CI632, which is the MRI, the 3T MRI compatible version. And with this device, we can deliver the stimulation closer to the hearing nerve than ever before. What you see on the picture here is a cross-section of a human cochlea, where you see that the electrode array is placed around the inner part of the cochlea, which is called the modulus. That's why we call these devices paramodal electrodes. But for the first time in industry, we've been able to demonstrate that we can deliver the electrical stimulation very close to the hearing nerve with a very small and atraumatic electrode array. Cochlear has had this technology before, but the electrodes that we had before were much larger and potentially could be more traumatic in the cochlea. So with this array, we can deliver the stimulation close to the hearing nerve and make sure that we have consistent what's called scala tympani placement, which is the part of the cochlea where we really want to have the electrode placed. Through that close paramodal placement and the fact that we have also very atraumatic placement, we can also now show the benefit of the high number of electrode contacts that Cochlear has in our system. Cochlear has 22 electrode contacts, which is more than other systems on the market, and we already shown through an internal study in 2017 that people can get incremental hearing benefit as we increase the number of channels from 4 to 8 to 12 to 22. But we're very pleased to see that a completely independent study, this study was completed independently from Cochlear by a leading research institute in the United States, the Vanderbilt University. In that study, they also showed an incremental benefit of delivering sound from 4 to 8 to 10, 16, and then all the way to 22 channels. And that incremental benefit was not only there in terms of hearing performance, it also was there in terms of sound quality. So it shows that by having world-class hearing sound processing and then delivering the sound to the hearing nerve in the most optimal way, that we can benefit from a high number of independent electrodes. As we saw on Dick's slide, hearing or using the phone is one of the major barriers for people living with severe or profound hearing loss. As we saw in this satisfaction study, I believe only 7% of people were satisfied with using the telephone prior to receiving a cochlear implant system. And so that is why when we developed the Nucleus 7 system, we paid a lot of attention to make it seamless for people to take phone calls from their smartphone directly onto their sound processor. Now, until recently, this technology of streaming sound from a smartphone to a sound processor was only available for iOS or Apple devices. But recently, through a long collaboration that our engineers have had with engineers at Google and GN Hearing, we've been able to bring this same type of technology also to people using an Android telephone. Android smartphone. So until recently, people had to use this extra device, this additional device, the phone clip, as an intermediate step between their Android phone and their Nucleus 7 sound processor. But now, recently, with the release of Android 10, there's no longer a need to use this additional accessory, and people can stream sound directly from their Android smartphone, from a compatible Android smartphone, I should say, to a Nucleus 7 sound processor, and potentially also to a GN hearing aid at the other ear. The third area of focus for us is to really simplify and streamline the aftercare. And of course, we see already many technologies that we are familiar with in our consumer world moving into the medical field. We have wireless technology, cloud connectivity, sensors and the Internet of Things and artificial intelligence all making their way quickly into medical devices. For Cochlear, that means that we have wireless technology both at home, where people can stream sound from their smartphone to their processor. We have wireless technology in the fitting room, where the fitting of children and adults can happen wirelessly. And we have wireless technology in the operating theater, where the nurse or surgeon can assess, as part of the surgical procedure, the proper operation of the device prior to closing the wound for the recipient. We have cloud connectivity that allows clinics to replicate their database into a secure place in the cloud, and that then allows Cochlear different service models, where, for example, we can ship replacement processors directly to recipients without the need to ask the clinic for any support in that logistic process. We have sensors and the Internet of Things, where we have what's called objective measures, which are ways in how we can measure how the ear responds to the sound that we provide, and then we can use that information to further automate and enhance the fitting process of cochlear implant recipients. And then, last but not least, we have artificial intelligence. We have just completed a study in the United States where we, for the first time in industry, used artificial intelligence type of fitting software to assist again in simplifying, streamlining that aftercare process. Now, a particular project that I would like to spend just a little bit more time on is remote check. So as I mentioned before, after implantation, people often return to the clinic 5-10 times in the first year, and then often once or twice in the years following. Now, we know that often that follow-up, particularly after a patient is stable, say after the first 3 or 6 months, that follow-up is merely a check whether everything is indeed okay. There's not necessarily an intervention needed at these follow-up steps. But yet, patients have to travel often many hours to their implant clinic, get the appointment, have the visit, and then, of course, travel back. And so Cochlear has built on the capability that we have both in cloud connectivity as well as in the streaming technology that we have with Nucleus 7. For the first time in industry, to build an application where recipients can, in the comfort of their home, can do a remote appointment. Yeah. It's a convenient testing tool that is part of the Nucleus Smart app. The patient completes their testing at home using their mobile device. They go through a number of tests. That data is then sent to a secure place in the cloud. The following day, their audiologist will get a notification that the patient has completed their tests. The audiologist then will verify, will check their results, and will let the patient know whether there's a need to travel to the clinic this time around, or whether there's in fact no need to make the journey to the clinic, and then we'll set up a new remote check appointment in the future. We've just started to pilot this technology about a year ago in the UK, and now other countries, New Zealand, Germany, and other countries are starting to roll out this exciting new opportunity to really streamline the aftercare process. And then in the fourth category, making sure that we have an appropriate portfolio of implantable hearing solution, we'd like to share with you a new hearing device that is in clinical trial at the moment. It's called the Ossia device. It's the type of bone conduction device that, contrary to the existing technology, is more or less completely implanted under the skin. It still does have an external component, external sound processor, but there's no skin-penetrating element with this technology, and at the same time, there's no limitation in terms of output power that we have with our so-called passive transcutaneous attract system. It has a broad fitting range of up to 55 dB. It features piezo technology, which is known to be very efficient, in particular to stimulate the higher frequencies, which are the parts of the sound spectrum that many people living with this type of hearing loss could or struggle with. This is a device, like our other bone conduction devices, that is for people that live with so-called conductive hearing loss, mixed hearing loss, or single-sided deafness. So it's a different category that we target this technology with compared to our cochlear implants, but we believe that Ossia is an important addition to our portfolio of implantable hearing solutions. So with that, I hope that I've been able to give you a quick overview of our 4 areas in terms of what we do to continue to enhance hearing outcomes, how we want to continue to make life simple and as normal as possible living with an implantable device, how technology can simplify and streamline the aftercare process, and how Cochlear continues to build out a portfolio of implantable hearing solutions to treat a broad range of hearing indications. Thank you for your attention.
Thank you to both Dig and Jan. and I hope you found those presentations interesting, informative. I hear them all the time, and I still do, so it's fascinating. Shareholders who are not able to attend this meeting could vote directly or appoint a proxy. Direct voting has been available to shareholders for many years, and although less than 2% of votes were cast this way, I think it's important that we offer this facility. This is a useful mechanism to ensure your vote is counted, and it does not require a proxy to attend. A considerable number of shareholder votes by proxy or by shareholders vote by proxy or direct voting. Accordingly, the board believes it's appropriate to recognise all votes cast, whether cast by shareholders who are present today voting directly or voting by proxy. Therefore, rather than calling for a show of hands, I'll call for a poll on each item of business set out in the notice of meeting, and the directors' voting recommendation with respect to the proposed resolutions are set out in the notice. Each poll will be conducted at the end of the meeting. It's unlikely the poll results will be available by the close of the meeting. However, as soon as they are available, the results will be released to the ASX, and we'll post them on our website. If you need assistance completing your polling card, then please ask one of the representatives from Computershare who are present. A representative from Computershare will act as the returning officer for the purposes of conducting and determining the results of the poll. There'll be time to complete the polling cards towards the end of the meeting. However, you may complete your card and cast your vote at any time from now until the poll closes. I would now like to move to consider the formal motions of the meeting. Item 1 deals with the receipt and consideration of financial reports and the reports of the directors and auditors for the year ended 30th of June 2019. The motion is detailed on the screen behind me. This item provides shareholders with an opportunity to ask questions on the company's financial and general performance. Cochlear's financial report, directors' report and auditors' report for the financial year ended 30th of June are incorporated in the 2019 annual report, which has been sent or made available to all shareholders. Shareholders have raised a number of questions directly with the company, and I've answered some of these in my address, but others I have grouped and will now answer them. Questions received by the company that were addressed to the auditor were passed to the auditor. A question was asked about a dividend reinvestment plan. Cochlear does not currently intend to implement a dividend reinvestment plan, but we continue to review our capital and cash requirements on a regular basis. A question was asked about future dividends being 100% franked. Cochlear undertakes most of the manufacturing and research and development activities for its implantable hearing devices in Australia. This results in the majority of Cochlear's corporate income tax being paid in Australia, which enables Cochlear to pay fully franked dividends. I would note that as we get capped in terms of the R&D spend we're allowed to get incentives for in Australia, that's changing the mix of spend and moving more of it overseas. And that's a public policy issue that we think is unfortunate because within reason we would like to have as much of our R&D spend in Australia. We won't have it all in Australia, but a significant proportion we would like to have here, and that's always good in terms of using the patents and other protections to bring income back to Australia, which will impact the amount of tax we pay in Australia, all things that we think are good. So we hope public policy will give us more flexibility to do more R&D investment in Australia with appropriate incentives, given that there are many other countries in the world that are actively trying to promote access to our R&D spend and offering us very attractive incentives to do so. Having said that, there's no intention to change the way Cochlear is organised, and therefore dividends are expected to be 100% franked for the foreseeable future. Any shareholder who has a question on these reports or on our business in general should raise them now. This is also an appropriate time to question any questions you may have to the auditor relating to the conduct of the audit and the preparation of the content of the audit report. Any questions will be directed through me. The process for this part of the meeting is any shareholder wishing to ask a question, please raise your hand and one of our ushers will hand you a microphone. You should introduce yourself to the meeting and ask your question. To afford as many shareholders as possible the opportunity to speak, each shareholder should speak briefly and ask all his or her questions at the time. Is there any shareholder who'd like to ask a question or make a comment?
Good morning, Mr. Chairman, Board. My name is Dan Steiner. I've been a long-term shareholder in Cochlear. I have 4 questions and I'll give them to you in plenty of time so that Ray can take note of them. The first relates to the Chinese manufacturing facility. I'm pleased to see the progress that has been made there. My questions are, Will this have an impact, hopefully positive, on Cochlear sales into China? Second component of that is, you've said it'll take until 2020. What is the estimated total cost of that facility? And associated with that, the facility that Cochlear constructed at Macquarie Park was ultimately sold soon after it was completed. Is there an intention for Cochlear to retain ownership of the Chinese facility? And the third question about Chinese facility is IP risk, intellectual property risk. I've asked that previously, but an update would be appreciated. Second question, impact of processor upgrades on sales and net profits for the company. Third, will the US marketing success, this is the client, what Jan was talking about, it is something that was initiated, I believe, by the previous president of US operations, and it has proved to be very successful for Cochlear. Will that process or approach be extended to other markets, particularly Europe? The last question is, you have indicated the intention to increase the number of people on the board, and the board remuneration is covered by a fee pool that must be approved by shareholders. There is no resolution on that at today's meeting, and with the expectation that as you increase the size of the board, they're all not taking a pay cut to live within the fee pool. And will there be an approach to shareholders to expand the fee pool within the next year or two? And finally, thank you for the update on the patent issue, the patent dispute issue. It's been running now for quite a number of years. And finally, congratulations on the continued expansion of employment and particularly the sensitivity for diversity.
Thank you. All right, thank you. We'll come back tomorrow. Look, at a high level, let's just look at China. China is a massive, I mean, I'm personally very interested in the children. So if you look at a lot of stuff I do, the children is what drives me. The adults are very important, but children really is a really good focus. And I guess when we went to China, we were observing a couple of things. We were observing they have 30 to 40,000 normal children in every respect, born deaf every year, just as one in 1,000 children who just unfortunately randomly are born deaf. That's an incredible number of children, and we've got to try and help them, and not a very small percentage of those are actually helped. As we went on the journey of looking at what we do in China, the governor of Sichuan, who comes out of the health ministry, has a passion for helping the children as well. And we aligned with him very well. I mean, he actually got what we wanted to do. He cared about the children. So that was actually a very good connection. And clearly the second message that was coming to us from China was, as they grow and become the part of China which is first world, because it's a bit of a country in three worlds, first, second and third world, but first world China is going to spend a lot more money looking after the first world children if it can, and they want to do it with a product that's manufactured locally. Now, for lots of reasons, we got the signal that it would be very advantageous for them to have someone of high quality manufacture in China. And as we went down that pathway, we were very strongly encouraged to come and manufacture in China, both for China and as a base for manufacturing for other emerging market and other for exports out of China. So there was a very good interchange there. And I'd have to say the people relationships we've had over the last 3 years have been excellent. The support we've got is excellent. We feel like in some ways we're on a very fast track. At the same time, we're very conscious of the fact that were that to change, just as the switch can go to green very quickly and be very supportive, it could go in the other direction. One of the reasons I hope it doesn't is because this is for the children. And I think they got the children. It's socially really important to them. And I actually think they, in a strange way, the 100-year journey we start every day really resonated with them. And I think they care a lot about that. And I think the other thing they realise is, which isn't, we don't talk about, but they've started to talk about, is they have 4 million adults going profoundly deaf every year. And that profound deafness is going to create a massive healthcare problem for them, particularly with their one-child policy, which won't have lots of kids and families available to look after this ageing population that could be heading for dementia. So there are lots of alignments, so lots of really good reasons to go there. So we think over time, and this is a 10-year journey, that we're doing this for 10 years. And we're taking some risks here that a lot of other people would say, why are you doing this? But if we look at over the 100-year journey, which is where we start from, you've got to believe that the major emerging markets the key ones are going to be China, India, places like Indonesia and Africa. We've got to actually take some of our dollars and strategically invest them into those marketplaces for 20 years from now. So we're taking the risk. We know what we're doing there. In terms of the cost, I mean, there are lots of ways of looking at the costs. I'm going to make Diggs responsible for the costs. So I'm going to let him guess what the final, how he wants to add it all together. Lots of ways to add a cost, but if he could just give a ballpark macro, that'd be good.
So we expect that the capital expenditure for the plant, including the equipment and commissioning, to be about $90 million.
Now, I would say at the same time as we're doing this, the other things we're doing in China is we're buying our distributors. So we're going direct. We're investing in that. We're investing in people to run the distribution slowly across more of China. So the manufacturing is just a small part of this. There is quite a substantial cost that is already in China, and we're dramatically increasing that and stepping up on that front. The other interesting thing is we made it clear to the Chinese before we went in that manufacturing, we will own the product. It's our product. We will manufacture it. We're not sharing responsibility for quality of product with anybody, and they bought into all of that. So we might do some things to mutualise, if you like, distribution channels, but manufacturing the core products will always be ours. Own the building. Look, I think we'll own the building. I don't think we haven't really thought about it. So I would say we will make rational commercial decisions, but at the moment, owning the building is what we're going to do, and we'll see where we go after that. And we don't have to own buildings, to be honest. So we'll review that in due course. IP risk, look, a comment I'd make is it doesn't matter where you are, whether you're in China or in Australia, we have IP risk. And anybody that wants to access your IP can get at you anywhere. So just because we're in China doesn't mean we're at a heightened risk or not. So that's the first thing I'd say. And I'd also say state players, whoever they may be, and it could be what we might classify the good guys and the bad guys. All the good guys and all the bad guys have the same access to get into anything they want to. So I'm sure what we might think as the good guys are doing nothing. I'm sure they're doing whatever they're doing. So IP risk is very important. Now, what do? We tier our access to anything that's IP, so we have all sorts of barriers internally to try and protect our IP. When we go into China, one of the things we recognise is that one of the major issues in cyber isn't actually your internal structures and how you set up all your firewalls and everything. It's your people innocently making a stupid decision, and through that stupid decision letting someone actually access into your systems in a very dangerous way. So in China, we're going to be even more careful because there aren't people there that have the same culture and awareness that we do. But look, all of this is we're doing everything we can to create multi-levels of control and protection, but no one is safe. So we spent 2.5 hours yesterday at a board meeting reviewing cyber security, and although it was a very good discussion and you felt comfortable, it also, you can never be comfortable in this environment. So there's no proper answer to perfection. You were talking about upgrades impact, processor upgrades impact. I'm not quite sure what that is. I'll try and answer my view of it. If that's not the question, you can confirm it. But every time we look at an external upgrade, that might actually every time you upgrade your externals, people may actually wait for an implant to get more modern technology. So when we do that, we would normally offer the upgrade automatically. If they take an implant now, we'll process that. Upgrades themselves as a function of penetration of the market for the particular product that's being upgraded, and they go through cycles. I mean, I think we've commented that the current upgrade cycle we're in is, we're well into that upgrade cycle and it will slow down, and we'll need a new product to then upgrade into the new cycle, and there's a sort of a 3 to 7 year cycle anyway. So these things go through ups and downs, and we're well advanced in the current cycle. At the same time, there are many people that are eligible for upgrades right across the portfolio that haven't been upgraded. So this is a sort of a moving part of, there's many moving variables, But clearly, if you saturate your market with an upgrade, then that will slow down in the short term and then pick up again later on. Is that what you're asking? So it's not a steady. It will have you've almost got to look at it on a 3 to 5 year moving average. That will give you the implications for that. DTC, so direct to consumer. There has been a lot of work going on for years now in direct to consumer. The US has led the way. I would say, I'll let Dig talk to it, but my observation would be all the learnings out of the US are being harnessed into the total organisation. It's spread across the organisation, but maybe you'd like to talk to that.
No, that's exactly right. We're taking, we have spread the direct-to-consumer campaigns through all of the developed world and some developing countries, and we continue to learn as we do this what's the best way, what's most effective in each market. And that's why the TV advertisement we're running in Australia at the moment that I mentioned, that's an experiment to see how that goes.
Your next question was about board and pool level. Look, over the next 2 or 3 years, we will be slowly adding new directors, and some of the older directors will be moving out. Clearly, in the older director category would be me, and would be Donald, and would be Andy. So we've had long service, and particularly with Donald and Andy, who bring substantial implantable medical device experience to the board and global healthcare experience. We've got to make sure before we let them move on that we've found appropriate people that bring that sort of skill set to us. And we're in Australia, so that's actually this isn't an obvious place for those sort of skills. People say to us, well, why don't you just bring on international directors? And we have done that. Abbas is based in London and Ed was based in London. But as a general rule, I would prefer to have directors, the majority of directors available on site with us here in Sydney or easy access to Sydney. So obviously a new chairman issue. There is a whole board. We have candidates to be chairman. We're grooming, so I've got, if I get re-elected, we've got to groom and work that out. We've got to possibly add more people to give us more choice, but I'm personally comfortable that that will all work out fine. And in terms of rotating out the other older directors, we can do that as well. When we find candidates, I think as I said, we have a couple of candidates who are excellent candidates. Where they're available to us, we have to wait for them to become available, and we think they're worth waiting for when we've interviewed quite a number of these people, and they're highly prospective. So we would rather wait a little bit and just do it in an orderly way and bring in people that really bring us value that we think is very, very important for us. And that will just happen over the next 2 or 3 years. I think you'll see that happen, and it will deal with both the medical device, it'll deal with a bit of diversity, and I think in 3 years' time when you look back, you'll say, look, we satisfied those various things, and hopefully someone else as chairman will be telling you, I think we've done a good job, and get your support. So, but we're being very careful on that front, and it wouldn't surprise you that all the older directors, and I think all the directors generally, the first thing that matters to us is do the right thing for Cochlear. Cochlear comes first, second and third, and our personal, whatever we need to do, we'll do the right thing for Cochlear, and I think that's what's going on. So we're managing that very carefully. Patents, your question, I sort of answered that. I mean, I think patents there are 2 parts to patents. Patents and intellectual property are the things in global developed markets anyway that allow you to attract higher revenue back to your source of domicile of the patent. So, for example, why do we have 70% of our corporate taxes paid in Australia with 95% of our revenue overseas? It's because we can bring quite a lot of the profit margin back through the patent structures, and also given that there's $2 billion of R&D that's gone into all those patents, and that's all expense. So the $2 billion is being expensed all the time. It's not in the P&L. It's taken out of the P&L. And so some of that's bringing it back to compensate you for those things. It's a bit of a worry if more and more of your patents are going overseas. And clearly, as our R&D spend is now at 180 million and the Australian cap is at 100, it tells you how much is going overseas. If it was at 100, if we were only at 100, we would always have some overseas. So it isn't all Australia or all somewhere else. but you'd like to be able to optimise the amount of spend that we have in R&D in Australia and have a sensible distribution over the world. It's being driven now by caps, government policy caps on R&D spend. Now, hopefully government will respond positively to that. I think they understand the issue. I think they're dealing with a bigger issue than Cochlear, so there are bigger considerations, but Cochlear and our patents are totally mobile, and they've got to find a way to balance that up to keep us in Australia. And as you know, Dan, I'm committed, if I can, to keep Cochlear in Australia. I mean, I think it's really important for Australia that Cochlear stays here, and I think Cochlear can be a world leader based in Australia, and I think Cochlear can show other Australian companies in life sciences that there's no reason they can't succeed in Australia. We've just got to get the public policy settings right so other companies can actually do that here as well, and that's a bit of a challenge. So that's patents. If there's patents in terms of access and security around patents, obviously we have the most valuable thing we have is our intellectual property and is the knowledge of our people. So they're the two key things we've got. So we spend an enormous amount of time trying to make sure that people can't get to our intellectual property. Some of our intellectual property is actually process knowledge, and it is different to a traditional patent, so we try to make sure we understand where that is. But the quality of the people is really, that's the other side of our future. And so those two things are the things we spend the most time on. And it wouldn't surprise you that most people in Cochlear really like being able to help a lot of people here and help the children. And it's a very interesting company where you're thinking about how to support a child for 100 years. To do that, you have to be a very successful company for 100 years. You have to run a very commercially focused business. You have to stay as the leader. You have to do all those things, and our people have the passion to be supporting those children and the adults, but supporting the children and to be there for 100 years. So it's a really interesting company. I'm very proud of it. Okay, any other questions? Yep.
Hi, Mr. Chairman. My name is Dudi Jab. I'm just wanting to ask you a question. Just if you referred back to on page 12, I can see that you've got the sales revenue for each region. No.
Page 12 of what? The annual report?
Wait, no. It's actually page 13. Sorry about that. It's page 13 of the annual report. You've got the sales revenue of each region: the Americas, the Europe, Middle East, and Africa, and Asia Pacific. But I can't see any cost to each one and the profitability. Will you include that in the future so we can see what the returns are like? And also, you said China is a leading participant. Will that get its own review, including with Indonesia and India, which is a growing market, so we can see the returns that we're getting from each based on the cost that we're investing in those markets?
That's a whole complicated set of questions, and we run the world by regions. We have a couple of major regions. For example, China's in Asia Pacific. We have the US. We have Latin America, and we have Europe and the Middle East and Africa. For lots of reasons, we give general information on a grouping on that level. I doubt that we're going to want to go down to give any of the details that you're asking for lots of reasons, including as the market leader, when we don't want to give any commercial confidence information away to our competitors who are working very hard to do everything they can to take market share from us. But you might like to comment, Dig.
On page 56 of the annual report, we actually do split out the EBIT by segment and the assets and liabilities by regional segment.
Sure, thanks.
Does that go down to the full? Because he's really asking for.
It goes to it just goes to the regional, and I can't see that we would go down to a country level.
I mean, it's very unusual, to be quite honest. I mean, it's an interesting question, and lots of people like to know the answer. All the other boards I'm on of multinational companies do not give information down to the country level, and there are lots of reasons they don't. The one country they probably do is the US because it's so major, but everything else is grouped, and you don't do that for confidence and commercial reasons.
Oh yeah, I got another thing. You said about the US, in the remote check on the slide there, you said there was a pilot check in the UK, Germany and New Zealand, but what about the America? Because that's the bulk of the bulk of your revenues. Are you doing a pilot check there with the remote check?
No, not at this stage. I mean, that's how we do pilots, is we select specific countries and we work in them. This is a new technology. We want to learn how it works before we expand it too broadly.
I mean, if it works, we will do it, but we're piloting it at the moment. Any other questions? Okay. Thank you then for those questions. You're aware that we've received direct votes and proxies in relation to the resolutions before the meeting today. I intend to reveal the number of direct votes and proxies held for each and against each resolution, and proxies for the chairman's discretion, where available, have been applied in favour of the motions. I now ask that the direct and proxy votes be disclosed to you. Thank you. So that's, we thank all those, that's great support. The poll on this item will be taken once all other resolutions on the notice of meeting have been considered by the meeting. However, you may wish to mark your polling card now as to how you intend to vote. The next item of business is to vote on the adoption of the remuneration report, which is set out on pages 28 to 43 of the annual report and is also on the website. This is a non-binding resolution. Voting exclusions apply to this resolution as set out in the notice of meeting. The motion is detailed on the screen behind me. Is there any shareholder who wishes to speak to the motion? Thank you.
Good morning. My name's Patricia Beale. I'm both a shareholder and also today the representative of the Australian Shareholders Association. We've received proxies from 219 shareholders, members and non-members of ASA, with total votes of nearly 195,000 shares, which would make us the 9th largest shareholder, I think. So basically, I'd like to congratulate you on the continuing long-term progression and increasing profits, etc., and all the other good things, sales and all the rest of it that feed into that. Specifically about the remuneration report, I'd like to say that there is a lot more information disclosed, and more clearly, which we thoroughly approve of. The particular long-term changes in the long-term incentives are certainly what we have been promoting for a number of years, and they do align very strongly with the focus of this company, and so we thoroughly like the emphasis being spread over the 4 years. In fact, we're starting to recommend 4 to 5 years, so there's always something more to do. But in any case, the change in targets of the annual growth rate, you're saying you're getting into more an evening out process. That seems slightly in contradiction to the new-ish emphasis on sales in a new market, which is the seniors market, and maybe you'll have a really big spurt of continuing high results from sales to seniors. We certainly hope that the company does continue to do very well in both childhood market and adults to seniors market, but we'll certainly keep a close eye on how those new targets work out in practice.
Yep.
But currently we'll certainly be voting in favour of the REM report. Thank you.
Thank you very much. Okay. I mean, I would comment that the whole issue around those LTI parameters. I mean, we talk to a lot of people. We review them all the time. We talk to lots of people about different alternatives. We canvass shareholder input for what we're proposing now. So there was a lot of discussion around it. It's a very complicated topic. It's hard to find. Everyone's got other Some prefer TSR, some prefer EPS. You know, there are lots of different counterpoints of view. We even looked at some other things that may be considered, but we couldn't come up with anything that was better than what we had. Clearly, for the last 3 years, we've been trying. I mean, the law of compounding is a very complicated thing. As you get bigger and bigger and bigger, it's one thing when you've got $200 million worth of sales, to grow your sales by 20% is 40 million. When you've got $1.25 billion worth of sales, to grow your sales by 250 million is a significantly greater challenge. So the first thing I'd say is, as you get bigger, those sort of levels of growth become difficult. For the last 3 years, we've been actually running the strategic plan initiatives in the company to have a 7.5% to 12.5% growth in terms of NPAT, and to try and look to do that into the longer term. And it wouldn't surprise you that the executives say, well, why are we being incentivised on an LTI that has 10 to 20% when the board's setting parameters that are 7.5 to 12.5? One of the reasons we wanted to be able to say we've been doing it for a couple of years before we tried to change it. And the other thing clearly was with just interest rate changes and all the other things going on, there has been a reward attached to the TSR. And that's been fortuitous in some ways, because I just think interest rates are increasing PEs. So who knows why it's doing that. But so there has been part of it which has actually given them some compensation through a period where it hasn't been clear. Setting the LTI EPS growth to 7.5 to 12.5 actually aligns the internal strategy planning with the shareholder incentive, the LTI incentive, and we just think it makes sense and it's the right thing to do at this time. So thank you for your comments. Are there any other comments?
Thanks, Mr. Chairman. My name is Duty again. In regards to the remuneration report, I'm just going to refer back to page 32, where it reads removal of EBIT as a performance measure. I just wanted to know why you're doing that, because and what are the cost measures in regards to that? And I know you're emphasising on sales revenue growth. What would you do to get to that? Will you borrow money to increase your sales revenue growth, or increase the cost of it, but not and reducing your profit margins? Just want to know about those sort of things to increase your sales revenue growth.
Do you want to talk to that, Glenn, or do you?
Sure. Excuse me. Thank you for the question. Look, what we've done with the short term is retain profit and revenue as the primary measures, but recalibrated them in a way that we think provides better incentive to our leadership. So instead of EBIT as an absolute number, we've introduced profit as a gateway, a net profit gateway. So either based on us achieving a net profit target, short term is either paid or not. And then the way we determine the size of the pool is revenue growth. And we think for a company of our opportunity, revenue growth is the primary driver for the people that are incented by STI. In terms of cost, we modelled this at various levels of performance, and it's self-funding. So should we overperform with revenue, it's more than self-funding in terms of delivery of any increase in payment to our executives.
So the key point there is that there is a performance gateway, which is at the profit line, which is pretty much the guidance we've given you. Around that guidance is a gateway that has to be achieved for the pool to be available. Now there is a board discretion around that, but that's the gateway, and so it's driving it to the global profitability of the company. Does that answer your question?
Yes, it does answer my question. Thanks, Mr. Chairman.
Thank you. Okay. Are there any other questions? Yes. Hello, Dan.
Mr. Chairman, I think the key thing for shareholders is the alignment of performance and shareholder benefit. When I read an annual report, and I'm not only limiting this comment to Cochlear, when I read an annual report and I find that the key management personnel are all getting 100% of the long-term incentive, the question in my mind raises whether the stretch is really a stretch, particularly if it's happening more than once or twice over an extended period of time. Mm-hmm. And if a board sees that it is rewarding executives all of the short-term and long-term incentives, then I think the board has every right to look at whether or not the criteria that it has established, in fact, are leading the executive team to perform at the highest possible standard. I understand that achievement of criteria is not always in the hands of the executive. It can be impacted by market conditions, and in the case of this company, by exchange rate fluctuations, etc. But from my perspective, if the chief executive gets triple his pay and I get 4% on my investment, then I want to go back to the board and say to them, please, guys and girls, men and women, look carefully at how you are framing the incentive program for your team. In the case of this particular company, while I join with a colleague from the ASA in saying 3 years should be 4, it's now 4, congratulations, that's wonderful. But as a shareholder, I can't but be happy with the results that I've gotten from the performance of the executives and the board.
Mm-hmm. Yeah. Look, it's, you know, you raise a whole range of questions. Some of them at the highest level, are we fairly paying our people and are we overpaying our people? So at that level, we do a lot of global, we're a global company. We're competing globally in 100 countries. We look globally at the sort of pay scales that are around the world. We monitor those and the pay scales in Australia, and on both counts, we're not out of range in terms of the peer groups of people working in other countries. In fact, I'd say we're quite reasonable in our industry. The second thing in terms of if people are performing, STI is if you perform as you expect to perform, then people should be getting a substantial STI payment. If you also, and I don't want to go into the philosophy of it because it gets very complicated in a shareholder environment because you've got lots of people telling you how to run your REM. And so when people come along and say, well, let's lower all the STIs so that people have flexes and everything else, well, all you do is see the base pay go up. Because there are a bunch of information out there which you all, those of you who understand this, know that people get paid a base, which is sort of, there's a median and there's a 75th percentile and there's a 100th percentile. There's the same thing for base and STI. We like to run a model which has as much as risk as possible. So we would probably tend to have a little bit less focus on base and more focus on STI, but the combination works. So there are a whole lot of things there that you're tuning, and I don't want to get into that, but I think the boards do that, and I think we try to do that. So I think we're very conscious of those things. The point you make about, well, should there be some bell curve of distribution? Well, you know, the bell curve of distribution, I'd also say when you get to the very top people, if they're not performing, they shouldn't be there for very long. So there's a sort of an issue there where, you know, you'd want them to be doing well, but we do discuss the bell curve of distribution and try to work out how you manage that. So all the points I don't have any problems with all the points you're raising. I'd just say there's a whole lot of exercising of judgments that we have to do to manage that, and you will see those high levels of performance payout in times when we're doing very, very well. Now, when you said 3 times, I thought you meant the base, so the chief executive gets base and he gets STI and he gets LTI. So he gets an uplift of STI for his current performance with his base, which is the work he does in the current year. And a large part of that is moved forward anyway, so it's got a deferral part to it. And then the LTI is totally aligned with the shareholders in a way that you have no problem with. So I think you've got to take the LTI piece away and go down to the STI and base piece. And we spent a lot of time trying to tune this. The more important thing is how we manage it across the whole organisation, and that's where the challenge is, because you want the organisation to have a bell curve of distribution. Some people are doing well, some people are less, some people are more, and there's a lot of messaging going on in terms of how you tell people that they're doing a good job or not. And it's a science. It's not a science, it's an art form, and we have lots of people working on that. So look, I don't mind. The questions are good questions. It's hard for me to give you the answer without you sitting in the REM meeting, and I don't want you sitting in the REM meeting. Any other questions? Okay. I ask that the direct and proxy votes be disclosed. the poll on this item will be taken once all the resolutions and notice of meeting have been considered by the meeting. However, you may like to mark your polling card now. Not too bad in the current environment, but the next item of business is the re-election of directors. I mentioned earlier, in accordance with our constitution, that Yasmin Allen, Donald O'Dwyer, Abbas Hussain and myself are retiring at this AGM and standing for re-election. The board considers all directors are independent, non-executive directors, and the board recommends them to you. Yasmin Allen is the first director standing for re-election, and her background has been set out in the notice of meeting. I'll now ask Yasmin to speak to her re-election.
Thank you, Mr. Chairman. Good morning, ladies and gentlemen, and thank you for giving me the opportunity to address your meeting today. I've enjoyed my time on the Cochlear board, working on behalf of you, the shareholder. Our board is focused on growing our core business and is working alongside management to make the most of our opportunities in an increasingly complex global environment. My background and experience has enabled me to be involved in this process, particularly in the areas of strategic and commercial thinking, risk and financial accountability. I have almost 20 years' experience as a company director, serving on major listed boards. I currently serve on the boards of Santos Limited and ASX Limited. I'm also a director of the National Portrait Gallery in Canberra and the George Institute for Global Health, which is a top 20 ranked medical research institute in the world. Through these roles, I've become a firm believer in informed debate, independent evaluation, and robust decision-making among members of the board. I have spent a large part of my executive career advising corporations and institutional investors both here and overseas. So I have a deep understanding of the elements of corporate success, and I'm focused on maximising shareholder returns over the long term. I'm the chairman of Cochlear's Audit Committee. The Audit Committee, as you know, is critical in the integrity of financial reporting and therefore investor confidence. I'm also a member of Cochlear's People and Culture Committee and Technology Committee. So from a corporate governance perspective, this provides the board with a link between risk and reward. I am impressed with the high quality and technically adept people at Cochlear. We continue to attract high-quality staff. And our strategy, as outlined by our CEO today, will, I believe, ensure a strong future for your company. I'm also proud of Cochlear's contribution to the community, with its exceptional products in the world of hearing that deliver extraordinary outcomes. But we do not rest on our laurels. We spend 12% of our revenue each year on R&D. And as you've heard today, we're investing in customer-facing technology and also in China expansion. I believe it's both the privilege and the responsibility of the board to think for the long term. During my past terms on this board, I've worked through the global product recall and seen our business recover and grow. The board has encouraged management to remain customer-focused and to invest in products and capability for the long term. I have the time to fulfil my duties as a non-executive director of Cochlear, and I have the desire and commitment to serve a further term on this board. My depth of experience as a director, and more broadly, is such that I believe I can continue to add value for you, the shareholder. Thank you.
Okay. Thank you, Yasmin. I now move the motion for re-election of Yasmin. The motion's detailed on the screen behind me, and is there anyone who'd like to speak to the motion? Okay, thank you. I don't see anybody. I now ask that the direct and proxy votes be disclosed. The poll on this item will be taken once all other resolutions on the notice of meeting have been considered by the meeting. However, you may wish to mark your polling card now. Donald O'Dwyer is the next director standing for re-election. His background is set out in the notice of meeting, and I'll ask Donald to speak to his re-election.
Thank you, Rick, and good morning, ladies and gentlemen. Today I'm standing for re-election to your board, and I ask for your support for my re-election. Just a little bit about my background. I've worked in the medical device health technology industry for 35 years. Initially, I worked as an executive living in Europe and then the United States. And more recently, I've been involved in this industry as a non-executive director on companies here in Australia and New Zealand. I believe that my international experience in the industry makes me well placed to execute my role and responsibilities as a Cochlear non-executive director. And clearly, Cochlear has now become a truly global company. It has been a privilege and continues to be a privilege to serve on the board of this great company. And with your support, I hope I can continue to do so after this AGM. Thank you.
Okay. I now move the motion for the re-election of Donald O'Dwyer, and the motion is detailed on the screen behind me. Are there any shareholders who'd like to speak to the motion? As I don't see any, I now ask that the direct and proxy votes be disclosed, and the poll on this item will be taken after the other resolutions on the notice of meeting are being considered. However, you may like to mark your cards now as to how you intend to vote. Abbas Hussain is the next director standing for re-election, and his background has been set out in the notice of meeting. I'll now ask Abbas to speak to his re-election.
Good morning, everyone, and thanks, Rick. I'm just going to give you a quick background on my career. As Rick mentioned earlier, I've spent 30 years working in the pharmaceutical industry. I was very, very fortunate in the pharma industry in that I got the opportunity to work in 8 different countries around the world, both mature markets such as the US. I was the general manager in Germany, and I had a wonderful period where I spent 5 years here in Sydney working for Eli Lilly and Company. I've also had a broad set of experience in the emerging markets where I physically spent time working in India, in Turkey, and I've spent a lot of time doing business in China. The last 10 years of my career were with GlaxoSmithKline. And my final role at GlaxoSmithKline before retiring was the head of global pharmaceuticals and vaccines for that business. And we conducted businesses in those days in 150 countries around the world. From a board perspective, my first experience on the board was working for 5 years on the board of Aspen Healthcare, which is the largest healthcare company in South Africa. I've also been on the board of Vive Healthcare, which is a rather complex joint venture between Shionogi, a company in Japan, Pfizer in the US, and GSK. Currently, I serve on the board of Immunocore. Immunocore is a private biotechnology company based in Oxford in the UK, developing immuno-oncology therapies to treat cancer. I'm also very, very proud to be here on the board of CSL. I noticed there's some familiar faces in the room from our AGM last week that was held in Sydney. From a family perspective, I have been married for 25 years to my wife Susan, who I met here. She's Australian. We have 3 children, all Australian citizens. It would be a pleasure to serve you on the board of Cochlear, and I hope you guys vote for me. Thanks.
I now move the motion for the re-election of Abbas. The motion is detailed on the screen behind me. Oh, sorry, we've done that. Questions? No, so with motions behind us, any questions from the shareholders? No, good, okay. I now ask that the direct and proxy votes be disclosed. The poll on this item will be taken once other resolutions on the notice of meeting are being considered by the meeting. However, you may wish to mark your polling card now as to how you intend to vote. Ladies and gentlemen, as this resolution coming up is the re-election of myself, I will vacate the chair and ask Andy Denver to act as chair for the consideration of the resolution. Thank you, Andy.
Thank you, Rick. Rick Holliday-Smith has offered himself for re-election. His background has been set out in the notice of meeting. And I will now ask Rick to sing for his supper and speak to his re-election.
You've probably heard enough from me today. The couple of things I would say is I've been on the board for 14 years. It's been a very interesting 14 years, and I've enjoyed every minute of it. I've seen the company grow from what I would call a big little company to a little big company and a truly multinational company, and it's been amazing seeing that. As first chair of the audit committee and then chair of the company, I've had a lot of opportunity to view many aspects of the company, particularly its financial, and then more recently getting a full understanding of its technology and what it does. I have a great passion for the children. I think we do really incredible things for the children. And those that know me know that I really, around the world as I visit lots of places, I see the children, and you just see some amazing, absolutely extraordinary stories. So it really just drives my focus on making sure Cochlear survives into the long term. And anyone that knows me knows that I'm totally committed to long-term optimisation of value. And it's really great to be able to have a company where you put in the framework 100 years as your view. We can't actually think clearly for 100 years, but you've got to put that in the frame. But we can definitely think clearly for 10 and 20 years. And when you have complicated decisions to make and you put them in the framework of 10 to 20 years, then all the different stakeholders and all the different issues all come out. And hopefully, if you do that over and over again, you'll make more good decisions than you make bad decisions. It's been a privilege to have a role to play in leading the board and working with fantastic colleagues. It's been a privilege to have some say in helping with the board structure the management teams and how they work. And it's been challenging to see how we build strategy into the long term, and strategy never stops. The challenges, if you went back 5 years ago, we would say we have lots of challenges into the long term. If you look at where we are now, we have just as many long-term challenges. Some of them are because we're big, and some of them are because as we're big, compound numbers means that you've got to keep growing to stay in the lead. And one of the goals, as Stig said earlier, was we've got to stay in the lead if we're going to last for 100 years. Anyway, it's been a privilege to serve you. It's been a privilege to be in the role, and I would ask for your support. Thank you.
I now move the motion for the re-election of Rick Holliday-Smith. The motion is detailed in the screen behind me. Is there any shareholder who wishes to speak to the motion?
Mr. Chairman, I have a few things to comment about your experience and your contribution. I've been a long-term shareholder and for a number of years was representative to this organisation from the Australian Shareholders Association, and in that capacity, I kept asking your predecessor why there were no women on the board. My recollection is you were appointed chairman in July, and in August, the first woman was appointed to the board. And that has continued in terms of your focus on diversity. Your company now has over 40% female staff, and your board has, thankfully, more than one woman. But there are opportunities in the future, Mr. Chairman.
I agree.
Secondly, your company, at your leadership, took a very daring decision when a tiny proportion of products failed, and you immediately instituted a recall of all of those products. And that was achieved without ever missing any one single implant throughout the period that you recalled and had to then get recertified that processor. Your openness with the ASA is to be congratulated. I never had problems accessing you, the chief executive, others on the board, and for that I think I'm very grateful both as a shareholder and as an ASA representative. And the other thing is your leadership has always looked for promotions within. The current president was promoted from within. His predecessor was promoted from within. And his predecessor before that was promoted from within. That stands very clearly as an example to all the people within the organization that if they do well, they have a career path within this company which will reward them and allow them to make increasing contributions to the success of the company. You have gone through a process as chairman over, I can't remember how many years, is it 10, 12?
Not that many.
At any rate,
7, I think.
You have been responsible for most of the renewal within this board that's happened over the period that you've been chairman, and you've just pledged today to continue that process through to the end of your role as chairman. And The board that you've put together has continued to drive this company to more and more success, for which shareholders should be eminently grateful. And finally, your company has moved from being a very largely research and development company in the last several years to being a company focused much more on markets, market research, market penetration, and that has continued this company, who has been a leader in product development for decades, to continue to be a leader within the marketplace. Your board leadership is something that I think is fantastic, and I've represented the ESA to a number of companies. I've never met a board that has been as consistently successful. The community in Australia, particularly the investment community, has seen boards topple, chairmen resign once they're investigated. Why are they investigated? Because they didn't do the job for which they were appointed. You have a board which has done the job exceedingly well, and it's because of the leadership that you provide to the board and the caliber of people you have brought onto the board. Thank you very much. I support your re-election.
Thank you.
There is another question or comment.
Yes, I'm just going to make a comment. I would like to say to Mr. Chairman, Mrs. Allen and Mr. O'Dwyer, thank you for your services to Cochlear. You have increased shareholders' value and also fulfilled your community obligations, so thank you for that. And Mr. Hussain, I know that you do a wonderful job in being part of the Cochlear family.
Thank you very much. We couldn't have said anything better than that, could we, really? I now ask that the director and proxy votes be disclosed. The poll on this item will be taken once all other resolutions on the notice of meeting have been considered by the meeting. However, you may wish to mark your polling card now as to how you intend to vote. And I hand the chair back to Rick.
Thank you, Andy. Okay, we now move to agenda item 4, which is the approval of securities to be granted to the CEO and President under the Cochlear Executive Incentive Plan. The motion is detailed on the screen behind me. As noted in the notice of meeting, while the terms of the plan mean that any exception to ASX Listing Rule 1410.14 applies, the company is seeking approval for the grant of the long-term incentive awards to the Chief Executive, as it is the company's practice to do so and for good corporate governance. Voting exclusions apply to this resolution as set out in the notice of meeting. And is there any shareholder who'd like to speak to it? I'm not seeing any. Am I? Okay, I now ask that the direct and proxy votes be disclosed. The poll on this item will be taken once all other resolutions on the notice of meeting have been considered by the meeting. However, you may wish to mark your polling card now. If you've not already done so, please complete that voting card, marking for, against or abstain in the appropriate boxes for each resolution. And if you have any questions, please raise your hand and a representative from Computershare will assist you. Your completed voting card should be given to the representatives from Computershare who are passing through the room. I think we're almost done. There's one in the middle here, behind you. Any green cards left? Okay, it would appear that all voting cards have been returned. and I now declare the poll closed. As I indicated before, the poll results will be released to ASX as soon as they're available, and the final item of business is to attract any other business that may be legally brought forward. To my knowledge, there's no notice of other business received, and the meeting is now concluded. I declare the meeting closed, and I welcome you to all join us upstairs for some refreshments. And thank you very much for your support.